Amy, thank you so much for speaking to us in Medicine in a Nutshell.
You're welcome.
You're an operating department practitioner.
Yes.
Which is ODP for short.
It is.
So when did you actually become an ODP, please?
I qualified for my course on the September of 2014, so I've been qualified for 2 years.
And you qualified from Sheffield?
Sheffield Hallam University, yes.
And how long a course was that?
When I studied, it was 2 years, but last year it turned to degree, so now it is 3.
Okay, and in the 3 years, is it a lot of it is lectures, or is a lot of it actually on site?
For your first year, it's definitely sort of a 50-50 split. When I was doing it, you were required to do 37.5 hours a week at your placement, but that was split up into blocks. So it was a block of university, a block of hospital time, and a block of university again. But towards the end of your training, you spend a lot more time in placement.
And when you say placement, you mean in a hospital setting?
In an theatre department.
Yeah,
yes.
Operating theatre, essentially.
I also spent a small amount of time on the maternity ward, and I also spent time in ICU.
Okay. And so what's actually the remit of an ODP, please, for people who don't know?
I was always told that we're classed as a jack of all trades for the operating theatre.
Okay.
We can do everything in an operating theatre. We are the anaesthetic assistant, a scrub nurse, and a recovery nurse, all rolled up into one beautiful scrubbed package.
But can if you, when you become an ODP, can obviously you sort of have all 3 roles, but can one choose to have more of one role than another? Depends on your particular.
Yeah, I mean, if you prefer anaesthetics, you prefer anaesthetics. If you prefer scrub, you prefer scrub. And once you've qualified, you can definitely guide yourself in more of a sort of a direction. Scrub and anaesthetics tend to be the more heavily relied on sort of areas, whereas people who go to recovery do tend to be recovery nurses. But I do know a few ODPs who went to recovery and have never looked back to the actual theatre setting.
Right, I hadn't realised that recovery was part of it. I always thought you were guys just scrub and anaesthetic.
Everything.
Everything. Very good, very good. And in terms of getting into being an ODP, presumably you've got an idea of what people need now if a person wants to get in?
Yes, so I previously did a degree before doing this anyway. So I've got a degree and this diploma. The people who entered at the same time as me required just GCSEs, but now you require GCSEs, English and maths and science is a definite, and you require 112 UCAS points for Sheffield Hallam University from your A-levels. I don't believe they've got to be particularly sciencey subjects, but you've got to have those grades. Right,
so it doesn't need to be like biology and stuff.
No, I'm not under the impression you've got to have your sciences, your GCSE, maths and English, but I think that's sort of a board thing for most universities anyway. But you've got to have the 112 points.
And you, interestingly, you said you had done a degree before.
Yes.
So is it reasonably common for people to go into ODP as a post-grad sort of thing, as it were?
Yes, I believe there was a girl on my course who was 18 when the course started, and she was one of the youngest people there. I was 21, maybe 22 when I started, and I was also probably the third youngest person there. A lot of people go into it sort of late 30s, early 40s, because it's
Why do you think that is?
I think it's an unknown job role.
Yeah.
It's a very unknown job role, and I think they'll hear about it from someone, look into it, realise that it's a fairly easy course to get onto, or it was when it was a diploma, and think, hey, that sounds interesting, I'll try for that.
And did you do any sort of work experience in ODP before you entered?
I did 2 days at York Hospital in their orthopaedic department, and it was incredibly enlightening and also absolutely horrifying at the same time.
How so?
You forget, you desensitise yourself to sort of cannulas, needles, drilling, bones being sort of hit, and skin being cut, blood,
regular stuff in an operating
regular stuff to us now.
Yeah.
But as someone I was in my 3rd year of an English degree, sat there in a pair of scrubs watching, some guy have his hip cut out, just mortified that it was almost barbaric kind of thing.
Which you now know isn't barbaric.
No,
really,
it's actually
it's
fantastic. You know,
Yes.
lovely little ladies getting brand new hips and, you know, jiving to the end of the day.
Yes, it could be quite startling.
Yeah.
I'm sure. So if someone is interested in getting work experience sort of thing now, how does one do that?
So I did it through just contacting the hospital theatre department. I believe you've got to be over the age of 18 to actually go into an operating theatre.
That's correct, yes.
As a volunteer. But I emailed a couple of places and managed to get in touch with the clinical education. And they set it up for me. I went for a visit day where they showed me around, showed me a few bits and pieces, and then set 2 dates, and I was given an ODP sort of mentor/guide for the day.
Is there must be a national body for ODPs? Is that perioperative care?
It's HCPC with classes. We're under the Health Council Professional Council.
And can one contact them to get a...
I wouldn't. That's not how I'd go about it.
Go straight to the hospital?
I'd go straight to the hospital. Go straight to the hospital. If it's a hospital in your area that you are aware has got theatres, that's what I'd go to. Or if you've got a university in mind, maybe get in touch with them and see if they can link you to any places.
Yeah, that sounds like a very good idea indeed. Now, do you enjoy it? You've been in the job for 2 years.
I have.
What's the good and the bad? Other than me being really good.
Spending all my time with you. The bad, it's... You come across some things that you now aren't desensitised to. Stuff happens and you go home and you think, oh my God, that poor family, that poor person, the human factor, you know, occasionally.
Which is part of all healthcare, unfortunately.
Yeah, it is.
Yes.
I mean, I do a lot of night shifts. I do a lot of anaesthetic night shifts, which is one of my highlights of my job. I love doing, you know, the emergency stuff that comes in, the stuff that changes, you know, in a drop of a hat, and it reassures you that I do know my job, I can do my job.
But the night shifts will attract the sickest patients having operations.
Yes, life or limb.
So highest morbidity, yes.
Yeah. I seem to have a bit of a jinx that I spend quite a lot of time down in A&E as well with patients who require intubation down in A&E, which is both the exciting part because it's very, you know, quick thinking, gotta do. But at the same time, if that gotta do doesn't go, you know, the way it needs to do, you hit the bad part, which is the human factor, the family on the other side of the door, you know, a patient dying, you know, just horrible things like that.
Yeah.
And children
what are the
are
good
awful.
things?
The team.
You mean children not being well is awful?
Yes, children not being well. Children full stop. They don't particularly like us when they come to theatre. So they do cry.
You're sticking needles and stuff.
Yeah,
of course, we're
horrible.
like you.
We're horrible people.
What are the good things? Tell us about the good
teams,
things.
the people you work with, fantastic. You work in such an unusual workplace that it becomes like a family bond. And these people they're just so fantastic. They've got the best sense of humour and they understand everything you're going through, so they become like a support network as well. If you've had a rubbish day, they've probably had a good day, they've had a rubbish day too. You can talk about it, you can, you know, and stuff's interesting.
Do you think that team thing in a theatre setting, the team approach, do you think that's important?
Drastically. Oh, so but I don't think anybody could do this job alone.
No.
Nobody could do this job alone, not without, you know, an anaesthetist who's got a whippy comment or, you know, something interesting to talk about, or a surgeon who understands that, you know, everyone needs to have a conversation, we all need to talk together, and this sort of equality between us. It doesn't matter if you're qualified, it doesn't matter if you're a HCA who's not qualified, it doesn't matter if you've been a surgeon for the past 20 years, everyone's a person.
But that's doing the job. But do you think the team's also important in keeping each other sane, as it were?
Yeah, oh God, yeah.
It can be quite trying, can't it, in
It can
theatre?
be incredibly trying,
Yes.
it can be incredibly trying. And if you need 30 seconds of just going up to someone and just going, there's always someone for you to go up to and drastically shake your fists at.
Do you mentor anyone?
I'm doing my mentorship at the moment, but I do seem to get a fair few students come pounding through the door, so yeah.
Do you enjoy that?
Yes, I love teaching. It's something that in the future I'd like to...
An academic sort of bent,
yeah,
yes.
I'd like to stay clinical as long as I can, because I thoroughly enjoy the clinical side to this job. But at some point I'd like to go to university and lecture. I think that's sort of where like to end up.
So if you had a word of advice to give to someone who may be considering being an ODP, whether it be someone a young un or someone a little bit more advanced in years, what would you say to them?
I'd say definitely get a chance to go into theatres and give it a try. And be prepared for standing up for a very long time. Nobody warns you about that. The 10 hours, 12 hours shifts, you really don't sit down as much as you think you're going to be sat down. Mainly go into theatres. Because a lot of
work.
Yeah, a lot of people apply and think it's going to be sort of Holby City, Grey's Anatomy, sort of. It's absolutely nothing like that. It's far worse, and it smells quite a bit sometimes.
Excellent. So thank you very much. That's really a very comprehensive insight with a bit of comedy thrown in, obviously. And hopefully that some people look at this and think, ODP, maybe we give it a shot, eh?
Yeah, well, we need people, so you should.
That's the last question is, do we need ODPs? In the UK, are we short of them?
We're incredibly short of ODPs. I believe when I qualified my year at university, 100% of people got jobs.
Fantastic.
Walked straight into jobs.
Thank you so much.
You're welcome. Thank you very much.